Hello, I'm Dr. Baines. We see a lot of patients all over the UK via GMC registered doctors who assess patients with tired type syndromes who've hit a roadblock with the NHS. So they could have all the symptoms and have an actual diagnosis like chronic fatigue syndrome or fibromyalgia, or they may not be sick enough and every single thing is normal, yet they're facing all the symptoms. And these are people stuck in the middle with no diagnosis. However, we find that there is usually a pattern in most of these subset of patients, and we look for patterns and we look for things that can explain why it's going on, because what's happening is that the engine of your cell is not working as it should. This is a real thing and it impacts every aspect of your life. And so we are looking at chronic viral diseases, genetics, your environment, your hormones, which is really has a huge impact, and stress, not just physical day-to-day stress, also emotional stress. And it could be stress relating all the way back to many, many years, and it can consistently can continue. There's a really interesting study in medicine today called psychoneuroimmunoendocrinology. It's a bit of a mouthful, but it's exceptionally exciting and a new field. And it's wonderful that it's starting to be recognized as having an impact on how your cells behave. So these are the kind of things that we look out for, and we won't wait for a diagnosis. We will see you. We use a functional medicine approach when we see most of our patients. Now, what is functional medicine? A lot of people have heard the term, and some people haven't. It's basically a root cause approach to diseases, as opposed to a band-aid approach where you have a headache, we just keep giving you paracetamol, but we don't try to understand what's causing the headache. So that's a very simple way of explaining it, and that is what a functional medicine approach is. So for someone who comes to us with chronic fatigue syndrome, it could be multiple causes and it could be one thing causing another and another. You find that quite frequently the same person will have multiple different things going on at the same time, which has a domino effect. And when we approach this, we have to really take all this into account, go down, try to figure out what is the key process that would probably benefit from the most management. And you find that that can then have a domino effect in the opposite way. And we find that to be quite an interesting approach and a really relevant approach. Just telling someone to, get up and exercise a bit more, do a bit more, is not the answer. In fact, it's the absolute last thing we should be telling patients, because all these things make you tired. So we need to take a step back, reassess it, have a look at what's really going on, what's the trigger to all of this, what are the multiple factors that's going on, and approach it that way. When patients come to see us, they are often wondering about what kind of testing that they may have to do. So the answer to that is that it could be no testing at all, depending on your circumstances, to uh, maybe two or three different types of tests depending on how little or how much each patient wants to do. So how do we decide this? Well, it's decided based on a few factors. We have some patients who are so far down the CFS route that they find that they can't handle too much of anything. In these cases, we find that the best thing to do is to go really, really slow and possibly no testing initially, until we are able to get them to a certain place where their brain fog has decreased and the ability to do more is there. And we're also quite cognizant of the fact that a lot of our patients who have chronic fatigue sometimes have had to decrease their working hours. They have budgetary constraints that maybe was not there before, and this has to be taken into account. And all our doctors are familiar with that, and we know what we have to work with. So it's a together discussion. It's a two-person discussion. We will be discussing that with you to see where you're at, not just based on your financial, how much you want to spend at any given point in time, but also what you're able to do mentally, because testing is exhausting as well. It does mean that there might be a lot of actions post testing, so we want to make sure that you're in the best place for that. For patients who are interested in testing, you might wonder what type of testing that's actually available for someone with chronic fatigue, but has already exhausted whatever the NHS can offer them. So we have to take a step back, think about what can possibly cause uh, chronic fatigue to happen in the first place. So you have things like chronic infections, which is still sitting in your body. And keeping in mind that we will only test if we think we can make a difference. If we don't think we can make a difference, we will not test. because what's the point? So the testing that we do will cover things like chronic viral, low-lying infections that maybe won't be picked up by normal testing. We definitely have testing for hormones and to look at the rest of your system. We could even do testing that looks at your environment and most of the other systems that exist, even down to your cells and your mitochondria, which are quite specialist tests. And so based on what we find, there are usually things that can be done, which then takes away the guesswork. Now all the management will be quite targeted. We're not guessing anymore. And in the long run, I feel it saves you a lot more money when we have the right information. However, like most things, we will go at the pace that you're able to go, and not every test will give us what we know. And it just means that we're able to rule things out as we go along. This is an area that we've been doing for a lot of years, so we do have a lot of experience in it. And do read up about, we've got more detail on the website, which tells you about the kind of testing that we do and the different systems. And this will definitely be based on your history, which the doctor will find out on the day of your consultation. Majority of our patients opt for one of the two consultation types, and that is our focus consultation or our comprehensive consultation. And as the name suggests, focus is focusing on one type of testing and less of a deep dive, but enough to get us started on a journey, versus comprehensive, where we look at up to 3 different types of tests. And it's a much more of a deep dive and much more of your doctor's time to explore the different testing, the interpretation of the test, and to talk to you about it and come up with a plan. However, for some patients, even this can feel a bit too much, in which case, this subset of patients are usually interested in things like low dose naltrexone LDN. So if this is you and you just would like baby steps into exploring this world, that's another option where you can look at our LDN membership, because it doesn't involve any testing. You don't need a diagnosis for that. We are happy to see you, and we're happy to help you get you started on this journey. Most of our patients ask if we do remote consultations, and the answer is yes. We see patients from all over the UK. And for those of you who cannot make it to London but are interested in testing, we can send test kits out to you in almost every part of the UK. We have connections with labs that are able to draw your blood and do the testing for you. And one of the questions we get asked, because a lot of our patients sometimes even they are too tired to even attend the consultation, or they have a lot of brain fog and may forget that what they wanted to ask. And so we get asked if they can have someone with them during the consultation. The answer is yes. Of course, you can have someone there with you, as long as you are also there, present, and understand what's going on during the consultation. And we can actually, the doctor can see you and can communicate with you as well. But we're quite happy for someone else to speak on your behalf, as long as you're there and present. One question we get asked a lot is if you need a formal diagnosis of either chronic fatigue or fibromyalgia to come and see us. The answer is no. As long as you have a tired type syndrome, where even if you don't have a diagnosis, but you're having all the symptoms, but you're simply not sick enough, perhaps, or they call it something else, as long as the core symptoms are similar, we are very happy to see you. And we're also happy to liaise with your GPs if you want us to. However, that is your choice, and we leave the decision making to you. If you would like us to communicate with your GP and find out more, we can. If you would prefer that this is something separate where you have the onus to go to your GP or your specialist on your own terms, we're very happy with that too.